Welcome to the Stress-Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. Hey, everyone. Today, I am joined by Dr. Ashley Lerman, and I'm super excited about this episode. I believe Ashley Lerman is the first pediatric dentist that I've interviewed. So, Dr. Ashley Lerman, thanks so much for joining the podcast.
Thanks so much for having me. I feel like we have a lot to talk about. I'm excited to be the first pediatric dentist too.
Yeah. And again, I apologize if I have already interviewed a pediatric dentist, but I feel like you're the first. And there's a lot I want to ask you. And thank you so much for being a pediatric dentist, because I need a place to refer kids, and I love that you exist.
I love that. Where do you usually draw the line? When are you referring out? What's your take on that?
Just if we see there may be a behavioral problem or just something we can't handle in our office, then we'll refer to the pediatric dentist. I'm outside of Massachusetts. I'm outside of Boston, so we have some excellent ones around here. But actually, first, let's find out how you decided to become a pediatric dentist.
Love it. So my dad is actually a general dentist. My mom is a periodontist. They work in a small 2-chair mom and pop office. So growing up, I'd always go and help out, answer the phones, those kinds of things. I knew through my experience in dental school, I wanted something a little faster paced and more dynamic. And I love the behavior and psychology behind pediatrics, both for kids and parents.
And now, after dental school, did you go right into pediatrics, or did you try general dentistry for a while?
I went straight through into pediatric residency. I did both dental school and residency at Columbia. And then I went to my first job, and I was seeing between 60 and 80 patients a day. The thing with pediatric dentistry, a lot of the time it can be volume based. So it was a very big grind, and a big pain point came out where, parents weren't being told early enough how to take care of their kids' teeth. So we had 3 and 4-year-olds who had 8 cavities already established. And they're like, how did this happen? So it led me to create First Grin, which is my preventive dental health company.
Okay. And I want to get into your First Grin for sure. But first of all, how do you handle 60 to 80 patients a day? I'm sure a lot of those are hygiene checks, and you're doing your operative cases. But how do you fit that in one day?
Yeah, they were long days. They were 10-hour days. You're on your feet all day. And it kind of felt like a broken record with, the things that we're going through in terms of what we're discussing with parents. So, I feel like there's a better way to approach it. But it took time straight out of residency to figure out the flow and timing. And, if I'm doing ops simultaneously as hygiene checks, getting a patient numb, walking out, doing some checks. But I think kind of jumping into the deep end and learning how to tread in that water was a big part of it. But you learn fast once you're in that situation.
Yeah, it's similar here. I have sometimes 4 or 5 hygiene chairs going, and sometimes I'm alone. Usually I have an associate or a partner, but you really got to time everything.
Yeah.
When you're getting a patient numb, then it's time to go do some hygiene checks. And if you run behind, it's not a good feeling. Did you just start to get your speed up and just figure out a rhythm throughout the day?
Yeah, I think that's it. In the beginning, you definitely run behind and it's uncomfortable, but it really makes you pick up your feet, see where you can cut a few seconds, and you really learn to read the room really well, really fast. You know, where you have to allot time, how much op you could get done in a certain amount of time to make sure you're able to do the hygiene checks and stay on schedule. So I'd say, you know, being thrown into it is the best way to learn how to keep up.
Are there some, do you do sedation? Are there some kids that need to be sedated?
Yeah, so sedation's a huge part of pediatric dentistry. We did all types in residency, from general anesthesia to, just drinking some medication, like an oral midazolam situation. I don't do much outside of residency, but there are always going to be cases that are necessary for that, especially for children, based on behavior, extent of needs, a lot of different factors.
And if needed, would you do that right in the office, or do you have to go to a hospital setting?
So it depends what the office offers. Sometimes they'll have an outside anesthesiologist come in to do either IV sedation or general anesthesia, or you get referred to the local hospital to do different types as well. Some offices will do in-office sedation as well.
Now, I always felt like pediatric dentists kind of had to have a special personality to be able to do what they do. Did you always want to work with kids?
Yeah, I think as a pediatric dentist, you have to be really dynamic and flexible and realize that if plan A doesn't work, you need a plan B, C, D, all the way through Z. And even then it may not work. So you have to be, go with the flow a lot of the time. With pediatrics, we work a lot with the special needs population as well. So I grew up, I have some members of my family with special needs, autism, these kinds of sensory considerations that we need to consider as well. So I think when you have that experience growing up, you learn, you have a lot of empathy, a lot of patience, and a big factor. I'm a newish mom, but I think being a parent has been a big component of being able to communicate and translate and understand needs on a different level than I was able to before too.
And what are your thoughts on parents in the room or staying in the waiting room?
So I would say 99.9% of the time nowadays, parents want to stay in the room and see what's going on. I've heard from older generation pediatric dentists, it used to be the opposite, where they weren't even allowed in the room. It's just a very different world now with social media and reviews. I think parents want to be in the room and make sure that they feel comfortable and understand what's going on. But it really depends on the practitioner. Some practitioners won't allow the parent in the room. I personally, I'm fine with it.
And what's a piece of advice if, let's say, we're working on a child and, they're nervous and they won't open their mouth and they're, you're trying to hide the needle and do all these tricks. Do you just kind of use talk therapy and talk them through it?
Yeah, I mean, kids are really, really smart. They pick up on parental anxiety if their parents are nervous, if parents are being like, if you're bad, you're going to get a shot. Kids pick up on that. We don't want to be framed as the bad guy. So parent has to be on our team as well.
Mm-hmm.
But, avoiding using words like needles, shots, getting down to their level, understanding that it can be scary and uncomfortable even for adults. And tell, show, do. That's a big thing in pediatric dentistry. So if you're using a prophy cup and they're nervous about the sound, show them on their hand, and just breaking things down into smaller pieces so they can digest and understand it's safe and we're there to help.
I to tell you the truth, I treat adults like they're just big kids, and I do the same thing. I'm not going to say, I don't say the words shots. There's certain words I just don't say. And I try to use lay terms and keep things simple. I remember one time I had a parent. I was working on a kid, and the parent was in the room, and she said, "Here comes the shot." And I'm like, "Oh, come on,
Yeah,
you're not
blows
helping."
it.
Yeah,
Yeah, it makes it a lot harder. It makes it a lot harder. But you're right. There's so much psychology behind it. We have parents come in all the time saying that they felt traumatized as a kid and their dental anxiety is still very much there as an adult. So I think the approach that you take is awesome.
I have a lot of those patients, and they come to me, and it's, we have that initial consultation, and they were, traumatized as a kid for whatever reason. But awesome. All right, let's jump into yourfirstgrin.com. Tell me all about the website and your products and your whole mission there.
Yeah, so my company's called First Grin. The website's yourfirstgrin.com. Social media is @firstgrin. So basically, when I was at this first job, I felt there was a very clear pain point of parents not being told what to do early enough. So what I decided to do is create intraoral care kits that I send out to parents through OB-GYNs, pediatricians, other dentists. We send out basically what to use, how to use it, and when. They're almost like baby registry gifts. They blew up on social media in that space, but it's educational and practical, all evidence-based. And I created an oral care companion app to go alongside of it. So has FAQs, reminders when to go to the dentist, a digital trauma guide for toddlers, sports age kids, connecting to a dentist, all these kinds of things that often gets neglected because we as dentists often see people once a problem's established. And my goal is to prevent it before it happens.
And tell me about the kits. What's in the kit?
Yeah, so right now we send the kits out to expecting moms through insurance companies as early as 6 months, sometimes even earlier. So it comes with, the baby banana toothbrushes, a mucilin gauze wipe to wipe the baby's gums, floss pickers, a teether, a gum brush, a little info booklet, again, on what to use, how to use it, and when, because often, and my personal social media at Pediatric Dentist Mom, I get questions all the time on when do I brush my baby's teeth? What do I use? Is my baby teething? So it covers these types of questions. Like, when do I take my pacifier away? When do I use a pacifier? So it just breaks everything down into digestible bits. So it's not overwhelming for a parent because new parents are so busy with sleep and their baby eating that dental care often falls to the wayside, which I'm totally sensitive to. But cavities are kids' number one chronic disease, and it's often very preventable. So I think there's a better way to combat it.
This also sounds like it's a lot less exhausting for the dentist to, I find sometimes explaining dentistry and saying the same old thing over and over and over exhausting. So if you have, links or website you can send them to, like what you're doing, I feel like that's so much more helpful because they say the statistics of someone actually listening and comprehending what you're saying to them is like 10 to 15% of what you said. So if you can send them to a website with all these FAQs, it's so much more helpful. Would you agree?
100%. It's kind of a no-brainer. And that's where the idea was spawned from. When I was seeing all those patients, I felt like a broken record. And I was like, we need a megaphone for this so we can make this tangible. And people also aren't going online and Googling preventive dental care, just not interesting. No one's really focused on that, especially as a busy new parent. So having that kit makes it, more of a touch point, an emotional thing too, as well.
And there's now, can dentists sell the kit right from their office, or do they send patients to the website?
Both. So we do wholesale discounts. A ton of different dentists like it as a marketing tool for their offices too, especially for family practices, because you gain a new patient right from the start. But there are several different models. Someone on social media can go online and buy it. Someone through their insurance company can see if part of it or all of it is covered. So I think that's really exciting. And for me, I love the public health aspect too.
I think you nailed it with the marketing too. You can really set yourself apart as a dentist in your local community or on social media by sending out educational information that you're discussing about these kits, and you become like an authority in the community.
Yes, absolutely. We see it among pediatricians as well. And then it kind of tees patients up to come right into your practice and start off with healthy mouth from the start. So they're just coming in for routine checkups and cleanings.
And typically, are you recommending a dentist or pediatric dentist to see the child before 6 months or between 6 months and a year when they have their first tooth erupt?
Yeah, so official guidelines say 6 months within the first tooth erupting or by age 1. Generally, people like to hear age 1, assuming they have teeth at that point.
And when do you recommend to introduce toothpaste?
As soon as the first tooth erupts.
Gotcha. And is that with just using your finger, or would you recommend using a brush?
So before teeth come in, you can use like a silicone gum brush, teether, something like that to desensitize, stimulate the gums. But once the first tooth comes in, you want to introduce a soft bristle toothbrush to clean off any plaque or stuff sitting on the teeth.
And when parents, I'm just in like rapid fire mode here.
I love it.
I honestly, I love the fact that pediatric dentists exist, but what about pacifiers? What are your thoughts on those?
Yeah, so there is data from the AAP that they're protective against SIDS in the first year. I'm very pro pacifier. People have different opinions if it may interfere with breastfeeding. But strictly from a dental perspective and jaw development perspective, we want to ideally start weaning by 6 months to just bedtime, sleep time, cut the habit by 18 months, and then definitely by 3 years, because past that, we see long-term data that it changes the jaw and tooth development.
Have you also gotten involved with sleep and airway?
Yeah, I mean, a ton of orthodontists have reached out to collaborate because pediatric dentists and orthodontists, like peanut butter and jelly, we work together all the time. And it's such a hot topic. Do you do that as well? Yeah.
I do. I do it. I do it for adults, but when I see a child come in and they're, struggling and they're snoring or they're having signs of sleep apnea or behavioral issues, then I recommend a pediatric ENT consult and an orthodontic consult.
Yeah, I love that you rope in the ENT as well, because I think the interprofessionalism between dentists and medical professionals is so important. Evaluating the airway and adenoids is so valuable because it may not always be strictly dentally involved. It could be, they just have big tonsils that need to be removed or shaved down.
What do you think are the biggest misconceptions that parents have about their kids and their teeth?
I hear it all day, every day that baby teeth don't matter. There's data that shows a single cavity in the baby tooth triples your cavity likelihood in the adult teeth. The most common decayed adult tooth is the 6-year molar. I don't think that's a coincidence. A lot of parents don't know when the 6-year molar comes in. They're not getting back there and cleaning and brushing it. So we really need to put heavy emphasis on prevention early on, getting the parents involved. A lot of parents are concerned that they're traumatizing their child brushing their teeth when, they may be holding them and their child's yelling or screaming. It's very fast lived. Like, health is a non-negotiable, similar to how we change a diaper, put a child in a car seat. If you reframe it this way and know that we have to be hands-on, I think it makes a huge difference.
And okay, so I want to move away from dentistry and get more into your role as a founder and an entrepreneur.
Sure.
What would you say were some challenges that you faced as a solo founder, a female in the dental industry? What challenges did you face and how did you overcome these?
Oh, so many. I have no business background whatsoever. So when I was just toying with this idea, I was speaking to people in the business world. I've bootstrapped my company from the start. And I was talking to investors just to hear their thoughts on the company. And they were like, I don't get it. Who's your co-founder? How are you going to do this? You need someone to balance you out. And then when I, just put the blinders on, decided to move forward and hire a freelancer for the things I couldn't do, I realized I can do these things. I've made so much progress in this short period of time that I've been doing this, and it's blown up in the space too, which just shows and highlights the pain point. That there needs to be a solution for this. So I'm excited to be able to do that. But yeah, it's just kind of jumping into the deep end and figuring it out. And I think that's a crucial part of being an entrepreneur.
Yeah, I'm actually updating my third book called The Stress-Free Entrepreneur, and it's all about that mindset. How did you go from that idea on a napkin to actually starting up the organization?
I came home from one of those very busy 60 to 80 patient a day, office days. And I was like, I'm so tired of this. I put together a very makeshift kit, something I just envisioned. And I found my first customer on Reddit, which is just an online message board. It was a grandma from California. So I sent it out to her. She wanted it for her daughter's baby shower. So, I followed up with her. I was like, what do you think of this? What do you like? What don't you like? And then just did a ton of R&D with all of my patients that I saw from then on. And then I figured out how to find a supplier, what products I wanted, create a brand and a name and all the colors. So it came together in baby steps, not very gracefully, but I think you just have to be willing to be messy in the beginning as an entrepreneur and just understand it'll come together with time.
Now, you mentioned the word grandma. I mean, grandmas and grandparents and parents, I mean, most of them will just do anything for their kids. So you're providing something where they're helping with their kids or their grandkids' health. So it's really, I mean, your market is, any human being.
100%. It's a no-brainer. Everyone, and I like to think everyone wants to do the best for their kids. I think part of the noise that we have to break through is this idea that baby teeth don't matter, but I think a lot more people are understanding that nowadays.
Um, I also want to go back to the fact that you mentioned, I think this is a great way to market also, is to reach out to the local dentists, OB, OBs, other physicians. I'm starting to do that more with my sleep apnea portion of my practice, where I'm just reaching out to the local physicians in the community to make myself the go-to person for sleep apnea appliances. And I feel like there's a lot of opportunity for dentists or pediatric dentists to do that, correct?
Yeah, absolutely. And I think we honestly take a burden off their plate as well, because if a patient is going to a physician with dental questions, dental concerns, they have a reliable, evidence-based, and trustworthy source to point them to. And that's what I found with First Grin as well. Like, hey, download this app. It has answers to all of your questions that you can understand. Similarly to how if a patient's mentioning to their physician, I'm having trouble sleeping or obstructive sleep apnea, they know who to point them to.
Can you actually say it again, the technology that's in play with First Grin? You said there's an app.
Yeah, so I built an oral care companion app. It has FAQs, blog posts, just resources that are evidence-based. Like, I know fluoride's such a hot topic, so it breaks everything down in a way that's understandable for parents, that isn't scary, isn't overly scientific. And it's oral care companion because you have it in your pocket just in case something happens. Similar with the digital trauma guide. If your toddler falls and you're scared of what you're looking at, it has a picture guide of what to do, how to do it, and when.
Okay, two final questions. Number one, how do we find out more? And number two, what advice would you give to the young dentist? And let's do three questions. Young dentist and young potential entrepreneurs.
Okay, cool. I love that. So to find out more about First Grin, follow at First Grin on social media. The website is www.yourfirstgrin.com. My personal social media is at Pediatric Dentist Mom. In terms of advice for anyone, really, I love this quote. It's a smooth sea never made a skilled sailor. So no matter at what stage you're in, if you're an entrepreneur, if you're studying to be a dentist, if you're in residency, if you're a dentist and you're starting your own practice, challenges will come. Just try to embrace them in the moment and take away from it, because it makes you stronger, it makes you smarter, and it builds your confidence moving forward.
That's great. And I feel like, dentists, we're so used to success when we're going through school and we're taking our DATs, we're getting the best grades. We have a path in dental school or a residency. And then you get out into the real world and everything doesn't go according to plan. And you have mistakes, you have bad reviews, you have failures, and we end up beating ourselves up. And it's just, you can't beat yourself up.
100%. It's just part of the process, and learning resilience is so key. Like you said, we're so used to being this type A personality where we succeed. And like you said, that's not real life. There are going to be so many unexpected challenges, not only in the career world, but balancing things in real life that happen too. So I totally agree with that mindset.
Awesome. Dr. Ashley Lerman, thank you so much for joining us. Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.